Assalamu alaikum. First of all, I would like to introduce myself. I'm Abdul. I'm student of Bahria University and I'm pursuing development studies. We are working on our health project. First of all, to introduce yourself.
Walaikum Assalam. I'm Dr. Zain and I'm working as a physician in Islamabad International Hospital Research Center. I graduated from Khyber Medical College, Peshawar, back 99, and then worked in the UK for 11 years, worked in Australia for 3 years, and worked in Johns Hopkins Aramco Healthcare for 5 years. And for the last 4 years, I've been working in Islamabad International Hospital Research Center. So, thanks for having me. I will try my best to answer your questions.
So, first of all, my first question is in your experience, what are the most common preventable health issues in our local community?
I think there are quite a few preventable issues in our community, especially working in different countries and comparing with Pakistan as well. You'll be very surprised to know that I never saw a case of malaria in any of the developed countries. I never saw a case of typhoid. I never saw a case of dengue in my entire career. I worked 20 years abroad and I haven't seen these diseases. So when it comes to preventable diseases, I would say all these diseases can be prevented. And they're usually because of good sanitation, healthy food, clean water, and clean food.
Okay, thank you. So, what do you think? What are the main causes of these health issues, and how can people prevent these diseases in their daily lives?
As I said earlier,
Yeah.
that perhaps the best thing is the sanitation. The religion we believe in gives a lot of attention on sanitation, but unfortunately, when it comes to the basic facilities of life, we do not get as clean water. We do not get as clean air, clean food as we should. So if we could improve our sanitation, hand hygiene, and these are very simple things which we can do, then we'll be able to prevent all those preventable issues.
My next question is, could you please share an experience of your patient who suffered due to lack of preventive care, and what lessons can be learned?
I would say an example of dengue.
Okay.
I never came across a dengue patient in Saudi Arabia or in Australia or UK. Only when I came here, then I came across dengue. And especially in the month of monsoon, dengue goes rampant like anything. And only thing we can do, like our public health department, they can do insecticide sprays. And there's insecticide sprays can help us a lot in controlling the dengue disease. Another thing I would say, what we can do, I mean, that's the government job. What we can do ourselves is basically, I'll come across typhoid a lot. So how can we prevent typhoid as such? I would say when the people come to me who have typhoid disease, I ask them one question: do you eat from outside? And I've come across these girls who are working and they don't get time to cook for themselves. So then I tell them, if you could get time to cook for yourself and eat a homemade food, it would be much better than you buy from outside, because basically typhoid spreads from chicken and egg. So if you eat from outside, then the chances of getting typhoid is complication. The disease which I never come across in the developed countries, only in Pakistan. So that is because I tell them to make homemade food, simple hand hygiene. Simple hand hygiene, that before you're eating, wash your hands. Third thing, typhoid vaccine. The typhoid vaccine is available. Pakistan, unfortunately, is part of the national immunization program as well. Maybe the generation now, which is now working or in the universities or studying in the university, they might not have the typhoid vaccine at that time, the national immunization program, but it is part of that. So typhoid vaccine, hand hygiene, eating homemade food, that will make a lot of difference for typhoid. So these are two examples I discussed.
Yeah. Thank you very, very much, Dr. Zain Abadin, for your time.